Welcome to the AUANews Inside Tract podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Hi, welcome to the AUA News Inside Tract. I'm Dr. Matthew Nielsen, former chair of the AUA Science and Quality Council.
And I'm Peter Clark, current chair of the Science and Quality Council for the AUA.
Today we're discussing the inaugural AUA Science and Quality Summit taking place November 13th and 14th, 2026 at AUA headquarters in Linthicum, Maryland.
This brand new meeting is designed to bring together emerging and established leaders in urology to explore the future of science, quality improvement, artificial intelligence, leadership development, and the evolving role of quality initiatives across our specialty.
We'll talk about why this summit was created, what attendees can expect, and why now is such an exciting time to get involved in science and quality. First question, why a Science and Quality Summit? Peter, could you share a bit about the vision behind creating the inaugural Science and Quality Summit?
Sure. I think, there is a time now, maybe more than ever, where you need to present opportunities to actually take a pause, bring people together, and really sink your teeth into the topics that are going to shape the way we practice and function over time. Our lives are so busy these days and so frenetic and so distracted and torn between all these different different things going on. That I think an opportunity to really sit down and focus on what does it mean to practice high quality, scientifically driven care, and then how are factors that we all know are coming going to influence that, such as artificial intelligence and others. So we thought now was a good time to bring that together and actually start putting together this summit and really give people an opportunity to really sink their teeth into this topic in a real meaningful way. So Matt, as someone who's helped shape many of the NUA's quality initiatives over the years, why do you think this meeting is needed now?
Yeah, I think it's a great evolution of the programming we have. Many of our listeners may remember a series of quality improvement summits we've had over the years that have been very kind of topic focused, multidisciplinary, and they were excellent. And we're, really, really grateful for all the folks who participated in those who attended those. And for our listeners, in case you missed it, all of the resources from those for topics covering opioid stewardship, imaging stewardship, multiple other topics are on the AUA website available for download. And so that, was kind of the legacy format for the QI summits. We have been watching with great pride and excitement the growth over time of the Public Policy Advocacy Summit in DC, and seeing that as a sort of the Super Bowl of advocacy where everybody comes together and there's a lot of great energy and activity, terrific programming. And as we've worked through our post-pandemic return to in-person meetings, there was really an appreciation of the things that our colleagues in PPC have done that gave us seeds of ideas to program this new one. And so we're really, really excited.
You see the quality movement evolve significantly. How has the conversation around quality improvement changed during your career?
Yeah, I think for those of us with more gray hairs, it was words that we really didn't hear growing up. Quality improvement, that kind of stuff. I mean, there's a lot of urology to learn, back in the day, but it was something that really, I think, came onto the scene in the last 10, 15 years in a much bigger way, certainly in urology. Whereas for the rising generation of folks coming through training in more recent years, folks in training currently, it is a big part of what they're learning and doing. And for those of us in practice, it's a big part of what we do today. So I think it's been really rewarding to see that evolution and growth and the multiple creative and supportive ways that AUA has helped develop programming to keep members up to speed and give them resources. And so I think the conversation overall has been really exciting. One of the themes of this meeting is how that kind of work very naturally, number one, connects with our intrinsic motivation as physicians to bring the best that we possibly can to our patients every single day. And number two, helps us understand how systems work and how process improvement works. That is a sort of good toolkit to bring into leadership roles that not surprisingly, many urologists ascend into. And so I think all of these things are connected and a really exciting growth in the field over the last 10 or 20 years. Looking ahead, Peter, what do you see as the biggest opportunities and challenges for quality initiatives in urology?
Yeah. So quality improvement is going to remain critical and central, as you've pointed out, right? Over time, we we just collectively feel we want to get towards value-based care. There's an understanding that we're overpaying, overspending for what we're doing, and the results on the back end aren't what any of us would describe as ideal across lots and lots of areas within medicine. So the whole notion of quality is, or value is quality over cost, basically, right? So a whole half of that equation is really to try and understand in depth, what are we doing it? Why are we doing it this way? How do we do it better? And just something I think we all inherently want, which is to deliver better care for our patients, right? And when we see problems, we want to fix them. And something you alluded to already, there's a reason why urologists inherently end up disproportionately in charge of things within systems, because we're good at this. Like, we recognize problems, we want to fix them. So I think the opportunity is to really put ourselves in the center of a lot of that focus, because it is going to be increasingly deriving a lot of the decisions that are made across the healthcare industry. And it's going to be even more so as costs go up and as pressures hit payers, be they government payers or otherwise, to try and ensure that, they're actually getting the value for what they're paying for. And it'll be incumbent on us, I think, to put forward that value proposition. The challenge is manyfold. One of the biggest ones is time, right? I mean, I would put to you that over the course of my career, it seems like there are increasing pressures on all of our time. So finding that time and space to really put mental effort into this is difficult and increasingly difficult. And, to something we alluded to earlier, that's the whole reason to have a summit, right? To actually carve out some time to get that process started. But I think it's because quality improvement isn't a one and done, it's a continuous process. Finding the time to do it is to me one of the single biggest challenges. And then, of course, technology is evolving rapidly, right? One of the reasons we brought artificial intelligence as one of the focal points of this summit is that that's changing so many facets of what we do in healthcare and then elsewhere, right? And so it is enormously powerful, but it also has its own limits and constraints. And so I think there's a lot of promise in how we might be able to use it, but there's also going to be some challenges and potentially some dangers if we don't use it properly. So I'd say those are probably the two biggest, at least the two that come off the top of my head.
In addition to AI, there are a lot of key themes that we're covering in this, and it was really a great exercise with leaders across the S&Q committees in the fall meeting to have a brainstorming sessions. And the AUA staff were incredible, supporting the teams, coming up with all the different ideas. And we had so many ideas that we weren't able to accommodate all in this first effort, but this is really planned to be the first of what will be kind of an annual meeting series. So stay tuned for updates that come in there. But Dr. Clark mentioned the AI theme is one that, obviously is top of mind right now, has lots of implications for what we're talking about. There are some other themes that we're, really excited to share.
Yeah, and one of them I think is leadership. As we were speaking about a little earlier, as urologists, we are disproportionately in charge of things within hospital systems. We tend to inherently lead just by virtue of the nature of who we often are. But I think by the same token, people don't necessarily start their careers thinking that's what they're going to do per se. And even if as that kind of evolves and they start thinking about, hey, I might be interested in leadership, they may not know how to go about it. And specifically as it relates to quality and quality improvement, that is often areas where people haven't been trained in the past and they don't exactly know how to be a leader within that arena, and how to leverage that and how useful that can be for career and career growth. So we thought this was an opportune time to bring in people who have been successful as leaders in urology, across healthcare, actually, even outside of urology, And how do they do it? What does that mean? How do you build a career that looks like that? What are the advantages? What are the opportunities? What are the pitfalls? What are the skills you need to learn? And we thought this was the perfect venue in which to start doing that, especially as a launch summit. As you said, we intend to have a recurrent theme year on year. We want to build on it. So this is one of the foundational pillars, leadership being some of the things that we want to build on.
Yeah, absolutely. Yeah, and for those who haven't seen the emails from AUA and the other programming, our great friend Dr. David Miller, CEO of Michigan Medicine, will be one of our keynote speakers. So speaking of, one among many urologist leaders in health systems, Dr. Miller, who we haven't been able to see at some of the urology meetings for a while, is committing to join us and share his insights on his journey. So that will be terrific, and we're really grateful to David for that. We've also covered the National Urology Quality Agenda in some of our other podcasts and some of the different materials that are out there. But just as a reminder for our listeners, the AUA was really grateful to have the excellent relationship we have with the American Board of Urology. I think there's a sense that the partnership and collaboration between AUA and ABU is a model for many of our sister specialties. So we're very grateful for our ABU partnership. And in partnership with them, the American Board of Medical Specialties made a call for development of a quality agenda in partnership with the specialty society. That would be us at AUA. And the timing of that was great because it was right around when we were sort of refreshing the browser on our priorities and strategic plan for the Science and Quality Council. So the summit will address 6 priority areas of the National Quality Agenda, and really thinking about how that guides future quality and research across the specialty. And I think the attendees will see those kind of peppered throughout the programming.
Yeah, and I think, having something like the National Quality Agenda, NUQA, you'll hear us refer to it that way frequently. It is really hard to know how to navigate a space unless you kind of know where you're going and where you're trying to get to. And having an agenda like this really helps outline and frame what are you trying to do? What is your mission statement? What would ideal state look like? What are the kind of things you're trying to accomplish? And having an agenda like this is really critical to try and outline those steps and actually map out the journey as you're trying to do it. So that's why this is such a critical document, and also why it will frame much of the conversations that we're having at the summit, not just this one, but future ones. And like any agenda and any mission statement, I do think it will be a living document that we're going to come back to and circle back to. And as things evolve, we'll change it. But as a roadmap, I think it's really critical. So I applaud the work.
Absolutely. So one of the goals of the summit, very explicitly, is to engage early career urologists, and there will be a lot of opportunities available for them. The Science and Quality Fellow, Dr. Max Bowman from UCSF, has been doing terrific work mapping out a variety of different pathways and new opportunities for residents, fellows, early career faculty to get involved in things. And we're really excited to have that be front and center in the programming. Peter, over your career, you've spent a lot of time mentoring younger colleagues. Why do you think it's important for early career physicians to get involved in this work?
Because your career evolves over time, right? Like most of us, when we started, I wouldn't have been able to map it out and say precisely exactly where I was going to go. You evolve over time as your experiences and as your opportunities present themselves. And as you find those opportunities to say, hey, I really like this. This is pretty dang cool. And then going to something like the summit, for example, and then seeing who else is part of this kind of work. How's it being done? What do the opportunities look like? How is the space even organized so I can start to learn how to navigate it? These are all things that start you on that journey. And if you don't start it, you'll never finish it. Right. I mean, and doing it at a young age gives you a long runway to start crafting and developing your career over the course of that entire span, and not just try to jam it in, when you're 60 like me. So starting young is really important. Plus, you want to bring fresh ideas and fresh energy. in order to have a really dynamic organization such as the AUA, and just urology in general, the dynamic nature of younger folk and the energy they bring and the fresh ideas and the new perspectives, that is so critical, right? Because if you just have the same people in the room all the time, you're going to get the same ideas. And at some point, they're stale, they're not working anymore, or they're not applicable any longer. So bringing in that young energy, that fresh outlook is absolutely critical, really, to define where we're going.
For sure. Yeah. Well, I think I would just emphasize that there is very intentional and deliberate programming for our younger colleagues, but also those who are young at heart or who are mid-career, later in career, but just really interested and curious and wanting to sort of explore this space more. It is really for everybody, and I think one of the things that we have seen. Several of our colleagues who really risen into very prominent leadership positions within AUA got involved in that, somewhat later in their career. So absolutely open to all, but just, responsive to what we've heard from folks in our community. The opportunity for, more pathways for people early on was something that was heard loud and clear. And thanks to Dr. Bowman for helping us engineer those pathways.
And to your point, look, there's lots of us that have started our career going in one direction, and you hit that moment where you kind of got that down, right? Like, particularly clinically. I mean, there hits a point where you know what you're doing clinically. You're not innovating in your own clinical mind anymore because you've been doing it for 5, 10, 15 years. A lot of us may at that point start to think about, like, hey, what other new direction could I take? How do I challenge myself again? How do I find that next level up in the course of my career? And something like quality improvement in this space, I think could be that for the interested individual. So I would totally support that idea. Young at heart, I like that. That's good.
Yeah, of course. So Peter, if someone could only attend one new meeting this year, why do you think it should be the Science and Quality Summit?
Because it's not going to be anything like you've been going to previously, right? We've all been plenty of section meetings. We've all been plenty of AUA meetings. We've been plenty of our specialty meetings. This is going to be profoundly different. We're going to be talking about a completely different set of skills, a completely different area, a different way to apply yourselves as a urologist, as a researcher, as an educator, in a completely different way. So I think it would offer you the opportunity to look at what you do in your career in an entirely fresh light. So that's what I would argue, that this is going to be new and different and exciting, and not like something you've done before.
Definitely. And I think, kind of riffing on what you were just saying, I think that idea of coming back to in-person meetings, there was that, period of time in the first couple of years of the pandemic where everything went virtual. And then we kind of got in the habit of not traveling as much. And it became, a little bit more activation energy to make that happen. And so I think it really is incumbent on those of us who try to put these meetings together to make it, really meaty and rewarding. And the kinds of connections and collaborations that people are going to be able to make in this setting, I think are going to be excellent. As with some of our, very kind of narrowly topic focused summits in the past, this will really be multidisciplinary. So in addition to, excellent leaders within urology and, colleagues, in the rising generation and, young at heart folks and, kind of a diverse group of urologists, there are going to be a lot of really, really kind of thought provoking presentations and conversations with folks from other areas, because we've learned over time that when we do have that multidisciplinary approach, like many of us do in the clinic, that, we learn some, really interesting things from our colleagues in general internal medicine, surgery, some of the other subspecialties. So when you review the program, you'll see that there's connections and collaborations, not only with the colleagues and those within our specialty, but really across disciplines, that I think is going to be another real highlight of this meeting.
Absolutely. And, the networking is so key, right? I mean, all of us have, where we've succeeded, generally speaking, we've succeeded in because of the mentors that we've been able to bring to ourselves and to help us. So this is an opportunity to make those network connections, meet mentors that it can help you in this space, and not do this on Hollywood Squares, which I think most of us are pretty tired of. So to having that in person, that connectivity and kind of rejoining everything together in in-person way is something I think we're all really looking forward to.
Absolutely. So I think, when attendees leave that inaugural summit on the flight home, we really can imagine lots of things they're thinking about, thinking about ways that quality improvement can incorporate into their practice, thinking about ways they can incorporate AI, thinking about really cool and thought-provoking things that people in other specialties are doing, thinking about the career pathways that leaders within our field have found that knit together based on the involvement and work that touches the space of the Science and Quality Council. And so, we really feel like a great turnout, and having people from across the country and across practice settings and across sort of phases of their career leaving inspired and motivated will be great. And I think one of our speakers also is going to be Jean Rhee, who's our president this year. And one of the things that Jean has been, I think, very passionate and articulate about is how all of this work is really sort of an antidote to burnout. It's been, sort of healthy to talk about burnout to a degree, but to, beyond a certain point, it's sort of unhelpful without, things that we can actually do and have agency on. And so Jean Rhee will help us see that light. And I think, his thoughts on it resonate a lot with others there. So hopefully people leave this, refreshed and recharged and able to charge back into their work with new energy.
Yeah, and I would just maybe you could speak just a little bit, Matt, to some of the research components that we're going to have in there. For example, I know it was an idea you came up with to have. I'm going to use the word Shark Tank. I know we're not officially supposed to say that, but the idea of having basically project pitches, and hopefully that'll be something that'll stimulate many of the attendees, not just with the ideas they hear, but maybe to come back the year following with their own ideas. So can you speak to that just a little bit?
Oh, sure. Yeah, thank you. I think that idea of crowdsourcing and really, bringing all the different ideas to light, it was really apparent when we got all of the committee members and council members and all together in the fall that, there are just tons of great ideas and observations and early experiences, all around the country. And so we tried the best we could to map out a program, based on that initial brainstorming session. But because of the energy and sort of enthusiasm that generated, we really thought, why not incorporate this into the summit itself? And so we're really excited to have people, as you said, not officially called Shark Tank, but a concept that is similar to a trademarked television show that is, idea pitches and, that sort of, space to put something out there for feedback and stimulate the ideas of others. So I think it's going to be a lot of fun. In summary, the inaugural AUA Science and Quality Summit takes place on November 13th to 14th, 2026 at the AUA headquarters in beautiful Linthicum, Maryland. We really are excited to get together, and it has been fun to talk about this with you today, Peter.
Absolutely. We hope you'll join us as we explore the emerging technologies, quality improvement strategies, leadership development, and the future of urology.
Great to see you, Peter.
Great to see you, Matt. Take care.
This has been an AUANews Inside Tract podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.